Welcome back, everybody. We hope that you had a refreshing break. The show must go on. Introducing our next keynote speaker, Dr. Sabariah Jaafar, who will be sharing her expertise on primary and specialist care in Malaysia. Dr. Sabariah Jaafar is the current Deputy Director of the Medical Profession Development Section of the Ministry of Health. She is responsible for planning, monitoring, and continuously evaluating the Subspecialty, aka Fellowship Training Program in the Ministry of Health.
She also plans and coordinates various committees such as the Jawatankuasa Khas Perubatan, which is also known as the Gazettement Committee, the National Credentialing Committee, and the National Fellowship Training Committee. She also bears the responsibility to provide technical input on the recruitment of contract doctors, which from house officers to specialties in terms of qualification, appropriateness, experience and salary, as well as appointment of doctors after retirement, making her a very suitable candidate to talk about the aforementioned subject, which is primary and specialist care in the Malaysian setting. So here, hence with great pleasure, we would like to present Dr. Sabariah.
Okay, sorry a bit late. Thank you, Madam and Mr. Shannon. First of all, I would like to thank the organizing committee for inviting me here to the NMI Medical Conference in 2014. All right, and I was this similar faces Dr. Amar, who is from Ministry of Health, invited guests, and ladies and gentlemen. I'm sorry again. Difficult to find this place, even though it's in Malaysia itself, right? Okay. Anyway, Assalamualaikum, selamat pagi dan salam sejahtera. So, okay, I've been given the talk on this, I would like to share with you all medical career development in the Ministry of Health Malaysia. Alright, even though the topic given to me was specialist care, but I couldn't argue with my big boss because I was given this topic. Anyway, I'll try to share some of the experience that I have in the Ministry of Health Malaysia. Alright. Okay, my flow will be introduction, health degree system, a little bit on housemanship training program, which will be touched upon by my Deputy Director General of Health tomorrow, I think, and of course the career pathway, which I will be sharing some of it. Alright. I'm not sure whether Dr. Amar has given the talk tomorrow. Okay, well, I think you've been hearing about lambatkan doctors, right? Which is written everywhere in the media that we have quite a number of doctors around. But to be frank, as far as the ministry is concerned, we still need doctors for our country. Right, at the moment, we have around, plus minus, about 50,000 doctors in the country, alright, of which half, I think, about 50-50 is in the Ministry of Health Malaysia. Previously, there used to be more doctors in the private, but currently about 50-50. So, same with the specialists, a little bit more, maybe 51% or so, is in the Ministry of Health Malaysia. So anyway, don't worry, we still need doctors for Malaysia, all right, due to demand, with higher expectation from our patient, as well as the demand for specialist care in the country. So we still need more doctors and quality doctors for more to give the quality care for our healthcare system. Right? And also with the complexity of diseases and the aging population, as far as we know, whoever who wants to go for your specialty or subspecialty, we are going towards the aging population. I think it's about 8% now. I think going towards 8%. So if there's 8% of aging population, meaning that we are going towards that population, okay, aging. And of course, with increase in the age, the more morbidity and all cases and more costly, right? and of course with new communicable diseases and development of new specialty. And of course, we'll be building up more hospital, right? One daerah, one hospital, I think. So that's why we need more doctors, right? Okay, what do we have now in our Ministry of Health as well as in the country? If you see from this, as I told you earlier, we have about 28,000, around about 29,000 doctors who are serving in the Ministry of Health Malaysia, right? And of course you can see there in non-MOH facility, about 6,000, and in private about 11,000, coming total to about 46,000, around about 47,000, all right? So in the non-MOH hospital, those in the universities and also in the Ministry of, some of the ministries in the public sector, right? Like the LPPKN and all that. So they do have doctors and ONG specialists serving in the ministry, right? And as far as the specialist goes, currently we've got about 4,758, including the family health physician as well as the public health specialist, all right? So for your information, the public health specialists now, they are on par with the clinical specialists, where they also receive the specialist allowance just like the clinician, right? So 4,700 is inclusive the family medicine as well as the public health specialists. So in the non-MOH universities, I don't have the exact number, but the estimate is about 1,000. I'm sure they have more people there, more specialists who resign from the ministry to go and work as a lecturer in the universities, right? And of course in the private, this one is limited to those who register with the NSR, and the current number as of August 2014, we've got about 2,700. So you can see here, there are more people serving in the public sector. But those in the private, maybe they have not registered, or even though they have put their Pakar Perubatan so and so, but actually they are not, they have not fulfilled the NSR requirement, and you know they're still about only about 2,700 has so far been registered with the National Special Register. And our total number of specialists so far in the country comes to about 8,600, or maybe they are 9,000, which I think some of our ministry people have so far not yet. I'm not sure whether to Amaya. Pediatricians are very good. All of them, I think, are registered with the NSR. Okay. All right. So what we need? Okay, the current number based on the doctor population ratio, we've got at the moment about 1:633, right? And our target for 2020 is 1:400, and we need about 81,000 doctors. As such, now we are receiving about almost 5,000 new housemen every year, and I'm not sure where we're going to put all this. We have to find a new facility to train all of you, right? Okay, if you compare where we're supposed to go with the developed country, you can see now this is actually statistics of 2012, but currently our doctor population ratio is 1:633, but this is the 2012 statistic. Malaysia is in between. You can see up there, right? Between the lower and upper middle income. But I think with the number of housemen that we're getting right now, we might be reaching this target much earlier, maybe somewhere around, well, 2017 or 2018, with the number we're getting right now. Okay. Okay, just a little bit of the healthcare providers. As you all are aware, Ministry of Health Malaysia is the core main provider of the healthcare in the country. And in the MOH itself, there are about 132 hospitals, ranging from the district hospital to the specialist hospital and state hospital. So currently there are about 132 hospitals, plus another 9 institutions, like we have IKN, mental health institution, transfusion center, right, the blood bank, PTN Pusat Darah Negara, and we also have 4 mental institutions. So it comes to about 9 institutions currently in the Ministry of Health, giving a total of 141 hospital or health facility in the Ministry of Health Malaysia, right? And over about 300,000 health clinics and community clinics in the primary care setup. As far as the non-MOH facility is concerned, we have 3 Ministry of Education hospital, UM, USM and UKM. And Ministry of Defence, we've got about 4 Ministry of Defence hospital, right? One in, I think, Malacca, and this Tunku Mizan Hospital in KL, and so forth. And of course, the other agencies include the Ministry of, just now I told you, Human Resource, where you have DOSH in that Department of DOSH under the Ministry of Human Resource. They are also providing certain aspect of the healthcare, right, to the country. And of course, in the private, you have more than about 200 hospital and general practitioners. And of course, if you are rich enough and volunteer, you can always serve in as an NGO, all right? So there are a lot of options that you can go through if you don't want to do the calls and all the stress work in the Ministry of Health. You still have other places to go to, all right? Okay, these are some of, just to show you our delivery system. Basically, it's divided into primary care, secondary care, and tertiary care, all right? So the primary care is actually under the Public Health Department, where the head there is a family, if you want to be a clinician, that means you can be a family medicine specialist and work in the public health setup. And under hospital care, we have the secondary care, providing all the secondary services, and of course the tertiary care, where there are more complex cases, we provide the subspecialty services. As you know, we have a few Center of Excellence in Ministry of Health Hospital. Alright, these are some of the examples. As I showed you earlier, primary care, secondary and tertiary care. So under healthcare, basically you have the health clinics and the community clinics, alright? Numbered to about 3,000 clinics. So if you see there, our community clinic, or previously known as a clinic desa, is no more a wooden building, but now it's a very nice 2-story building, alright? In most of the big centers, alright? And they have levels of, they call it clinics kesihatan. Now, there's no more clinic desa and all that. Even clinic desa is a brick, no more wooden, like the pre-Merdeka years, alright? Okay, just to categorize our secondary care services being provided by the state hospital. We have about 14 state hospital plus our HKL, of course. 13 state plus HKL, so we have 14 state hospital. But HKL, of course, it's very unique. It's also a referral center as well, a Wilayah Persekutuan Hospital, Wilayah, all right? And hospital with specialists, we have divided into 2 major specialist hospital, and the minor specialists, I think, is divided by the number of services being provided, as well as the number of bed in that particular hospital. And of course, we have hospital without specialists. Basically, if you are being posted to hospital without specialists, you have to work, you have to provide service in all the disciplines that is available there, all right? And as far as specialist hospital is concerned, the number is about 55 currently, but there might be more with the coming up of Shah Alam Hospital and all that. And hospital without specialists, so far we have around about 70 over hospital, right? So these are some of our hospital in Malaysia under the Ministry of Health. There's one there, I think Hospital Tawau is also there, which is a very nice hospital for those people who like to serve Sabah, right? There's a Hospital Tawau there. It's a very nice hospital. It's not a God-forsaken place because now, for those people who comes back from overseas, our policy is to send all of you to get the exposure in Sabah Sarawak first. It's a very nice place, right? Latama is a very nice place because we do send people there and they don't want to come back. They stay there, they get married there, and they stay there forever and ever. But of course, based on our policy right now, we do send housemen until they complete the 2 years. But for those who want to stay more, about 3 years, you can extend your housemanship training and stay more longer there. Okay? Really, it is a very nice place there, right? I mean, I'm sure all of you are from overseas, so Sabah Sarawak is not like those God-forsaken place, maybe in Ireland, and you get a lot of sick place there. Alright. So tertiary care center, alright, more complicated cases, as I said, more sophisticated equipment. But of course, as a houseman, I don't think you should go to the tertiary center. You should go and make whatever mistake that you want in the hospital without specialists. I think Dato' Amar agreed with me. If you go to Dato' Amar, he'll send you to this orang asli, which is nice because you don't understand what they say, they also don't understand what you say, so you can make a lot of mistake there, right? You can experiment on them. Sorry to say that. Anyway, orang asli now has already been, that's a joke aside, alright? They're all very sophisticated now. Joke aside. Okay, we have the centers, actually Center of Excellence, but we don't call it Center of Excellence. We call it the Tertiary Care Center. We have a few tertiary care center, and all of them, are in the Klang Valley, of course. So there's a lot of our specialists wants to stay in Klang Valley. All right. So these are some of the hospital. Ampang Hospital, famous for hematology, and Sedang, as you know, is a cardiothoracic, providing cardiothoracic service there. They have a pediatric cardiology, cardiac anesthesia, as well as adult and pediatric cardiothoracic. Okay, they're giving all these services there in Sedang. And of course, Putrajaya. Sorry, if you want to follow our DG, who is the breast and endocrine surgeon. And Selayang, as you know, is the hepatology and hepatobiliary surgeon, right? And of course, HKL, they're much more than pediatric surgery. They're almost all the subspecialty. We've got about, I think, roughly about 43 services, specialty and subspecialty services I found in HKL. So if you all don't get to get your posting in HKL during your houseman, you still get to go. Oh, sorry, it's all right, no problem. You think I'm tired? Thank you. I talk very fast because I got until 1 o'clock to go. Alright, so HKL, not really actually pediatric surgery, you still have much more, but 43 specialty and subspecialty services being provided in HKL. Right. Okay, just a little bit I'll touch on houseman. At the moment, MMC recognized about 366 medical colleges all over the world. I think it's not 35, it's from 14 countries, I'm sorry there. And of course, 33 colleges are within Malaysia itself, whereby 11 are in the public sector and we have 22 as a private setup, right? So already a small place like Malaysia, we already have about 33 colleges and 50 programs, because some colleges, they have several programs, all right? And I don't think we need to have more medical colleges now. In fact, we have put a moratorium on new medical colleges, and also in terms of building new colleges, and also the numbers. Ministry of Health as well as the Ministry of Education has put a moratorium on new medical colleges, right? So no more increase in the number of intake, no more new programs, and no more new colleges. And this is effective until 2016, and I think we will continue until further, all right? And of course, annually, as I said, we receive about 5,000 graduates, all right, annually since the last 2 years. At the moment, I think we have about almost 10,000 housemen in our 42 houseman accredited centers. So can you imagine 5,000 people fitting into 42 training centers? So that's why in one department you do have about 60 people. So they can always AWOL anytime, they can always forget when to come to work, they can always disappear anytime. So I hope everyone in this room do not do that, alright? So imagine training about 5,000 people. I'm sure that Dato' Amar has a tough time training all of you. Alright, so being a doctor, before you qualify to get your full registration, alright, as a requirement of Medical Act, you have to undergo a minimum of 1 year right? Minimum of 1 year housemanship training. So based on the Medical Act 1971, it states that a doctor will only get your full registration after you successfully completed the housemanship training program, which is of a minimum of 1 year. But in Malaysia, we have decided to increase to 2 years training program. So you will be able to ask our Deputy Director General of Health tomorrow why we have increased to 2 years. All right, don't ask me, you can ask him tomorrow. All right, so the houseman at this point in time is only being carried out in the public hospital, even though there have been applications from, or there have been proposal from some agency to have a private hospital as a training center for housemen, but I don't think it's feasible. Because as you know, in the private, you pay to be in the private, right? So I'm sure if you are a private patient, I don't think you want any houseman of 2 months undergoing training to come and poke your ribs and all that, right? So that was one of the reasons why I think, because you pay to be in the private, right? So I don't think you want a trainee to be examining you there. So that's one of the reasons why we think that private hospital should not be a training center for housemen, right? So you might be poking different vein and all that, right? So they might be, right? And of course now you have 9 posting, 5 compulsory plus obligatory posting like in anesthesia, in the emergency department, and of course the new kids on the block we have in the psychiatry ward. All right, not that our housemen are being sent to the psychiatric unit, but to give more exposure to our housemen so that they're able to function, function well before they are being posted or sent out to our peripheral hospital. All right, make sure you are well equipped and more competent, right, and safe to be sent out to the peripheral hospital to provide the quality services. All right. And of course, while you are undergoing housemanship, you are just given provisional registration. Once you fulfill the 2 years, then you'll be given full registration. So that's why during housemanship, you diharamkan untuk buat locum, right? Because you're just a provisional registered and you're not yet a doctor. So you cannot do locum. If you're found to be locum, then your registration will be struck out and you forever will never become a doctor. Alright, so be careful in future if you become a houseman. Alright, no locum until you get your full registration. Alright. Okay, just to show you the career for doctors. So I guess all of you here in this room are not being forced to become a doctor. Some. I heard that some of you are forced to become a doctor. Is it? No. I mean, it's not too late because you have not joined. I don't think any of you here who has already joined the housemanship training program? None. All right. So if you are forced to join, after 5 years, if you still think you are being forced to join, I think you don't have to undergo the housemanship training, which is, some of you think is very stressful, right? Right. But if you yourself willingly want to come into, take up a doctor as your career, so you know you cannot sleep well at night, you cannot eat well in the daytime or what time, so you know, you are well aware what is a career as a doctor, like no complaints. But we've been receiving so many complaints, tak cukup makan, tak cukup tidur, patient ni teruk, patient that teruk, and but if you want to be really a dedicated, then you should undergo the houseman and become a doctor, because there is no flexi time. After 5 o'clock you want to go back because you have somebody to waiting for you. No, there's no flexi time for doctors. So you all should know that, because you all come into this education program on your own free will, right? But those who are forced, then you have better think first. But this is really a career for you, because there is no flexi hours for you. Alright? They can call you any time of the day, any time of the night. And you can just go without food. In fact, if I can remember when I was serving in the hospital. Those days, quite some time ago, right? I used to do 5 Caesar in a day. So you can imagine the next day how I walk in cloud 9. 5 Caesar in one day, you know. And for those who want to be an OAG specialist, you also have to be really committed, because pregnant ladies deliver at any time of the day and night. You know, they don't come 8 to 4. So you have to be aware. If you are the patient, all right, and suddenly some doctors say, wait, I want to have my dinner, and your baby is coming out, you know. So put yourself, anytime you want to complain, put yourself in the patient's shoe, right? Okay, so no complaints, huh? All right, so as a houseman, after your undergrad of 5 years, you become a houseman, all right? After houseman of 2 years, you become a medical officer, junior medical officer, all right? And that takes about another 2 years, and then you become a senior MO. All right, so when you are a medical officer, you can start thinking where you want to go already from there. You cannot get stuck as a senior. But there are some people who get stuck as a senior MO. That's why I put them red in color. Some of you start working as a senior and retire as a senior, all right? So there's a red there. Or from medical officer, you can always join the master's program. Okay, now to join the master's is only 3 years in service, including your houseman. So 2 + 1, you can already join you are eligible. That doesn't mean automatic, you will get into the specialist program, but you are eligible to apply for the master's program, for the local master's program where the government will be sponsoring you. But of course, there are some fast-track doctors, all right, brilliant, with all the time in the world. They can always sit for the membership program, we call it, Dr. Amma is laughing at me. You have the parallel program, right? And for that, you can always sit 1 year after your basic, or your MBBS or MD, all right? For the membership program, you can sit anytime, because there is no experience required. But for master's program, of course, there are 3 years. You have to provide service for 3 years, then you can apply for the master's program. And soon after the specialist program, which is actually about 4 years, but the university gave you up to 7 years. So 4 to 7 years, you can stay put there, you can do locum there, you can sleep there, you can be productive there. You can extend all you want until 7 years, because now they see a lot of extension, during the master's program. Not only during the housemanship, but every year they will produce one baby. So by the end of 7 years, they're ready to become a specialist. All right, so let's say you continue after 4 years, you come back to the ministry, but some, they forgot to come back and they stay in the universities. They forgot where to find the gate to go out. They remain in the universities. So if you come back to the Ministry of Health as a specialist, as a clinical specialist, you have to undergo another 6 months of probational period before you are deemed to be a pakar or a specialist, all right? And of which you are eligible to get the specialist allowance, all right? So specialist, after 6 months, after you complete your specialist training program, you come back to the MOH and then you undergo 6 months, a minimum of 6 months. Some do take about 3 years to be gazetted. We have one who cannot be gazetted at all. So we don't know where is the problem. Maybe he chose the wrong profession from beginning. Anyway, you have to stay in specialist post for at least 5 to 10 years before you become a consultant. All right, and then senior consultant, it will be 5 years after you sit as a consultant. So all in all, about 10 years as a specialist. But of course now with the new time-based promotion, you get to be Jusasi much earlier. And you can ask that to Amar. Now the fastest we get Jusasi is 12 years in service. Previously, we have doctors who retire at UD 41. Believe me, it's a true story. They retire at 41, but now 41 is only meant for housemen. Right? If you are 5 years in service and you are still a 41, so meaning you're on your way out already, because we don't allow more than 5 years as a houseman. Right? You will be terminated from the government. Right? So if you undergo housemanship, one posting lasted about 1 year, 1 day, and then you can say bye-bye to being a doctor. Now we have implemented
1 year in one posting, then you'll be out. No more chance given to you, right? So more than 5 years, we will terminate you from the government, and it's not that easy. Because being a doctor, your first priority is to pass to get your full registration. So if you do not get your full registration, you cannot work anywhere. Not only in Malaysia, but anywhere in the world. But anyway, there's a good news. GMC has already recognized our housemanship training. So for those people who are from NewMed and for those people who have training program with the Royal College of Physicians UK, you will get a double registration. But of course you have to pay for that GMC registration. Alright, we already got approval, especially from those who are from NewMed and I think IMU, I'm not sure. Sorry, IMU or PMC. Right? But those who are from NewMed, you can apply for GMC because GMC has already recognized our housemanship training as part of the Year 1 foundation in UK. Right? This latest. Alright, so as you know, medicine is a full-time, lifelong learning. So you cannot sleep after your houseman. It's a continuous thing. Alright? So if you want to close your book after your houseman, this is not the career for you. It's a lifelong journey, alright, until you die. Okay, so you see here continuing professional development continues from undergrad until you're sub. So up there just to show you the duration, right? And for those who want to be a subspecialty, subspecialist, it takes about 18 years, alright? Even though how fast track you want to be. We don't want a fast track doctor anyway. A lot of complication, right? So 16 to 18 years. Even though I think there have been proposal to cut down some of our master's program, but of course it will take some time because currently our master's is about 4 years training, but there's been a proposal to reduce the number to 3 years, right? Okay, this is a bit to highlight on the specialist or postgrad training program. Our criteria for the master's program, for the local master's program, right? We have a master's as well as a parallel program. So for the master's, it's a 3 years training, 2 years of houseman plus 1 year. So if you have 3 years of housemanship, it will be 3 years plus 1 year, 4 years, right? And of course, the government provide about 1,000 scholarship currently. Previously, in 2008, there were only about 450 scholarship, right? But with the number of the doctors coming out, we have already increased up to 1,000. But sadly to say, even though we provide 1,000 scholarship a year, the university is unable to provide the training places. They can only give up to 700. So even with the number 1,000 slot, we can only get to train about 700. And as I said, there are quite a number of doctors who extend their master's program, and in fact they join the program just so that they can come out from Sabah, Sarawak or wherever they are. You know, the intention of getting into the masters is not the right intention, because some of you who are being posted to Sabah, Sarawak and cannot come back on time, the only avenue is to join the master's program, because all the universities are in Klang Valley. So that's the only way you come back. So after one month, you decided that you don't want to be a specialist, so you come out. So they quite maybe what 5 to 10% omitted to come out in the first 6 months of the master's program. And of course, in the last few years, we've noted that only about 40% managed to complete their masters in 4 years. 40%, right? Majority extended, all right, for some reason. But of course, you also have an entrance exam before you are being selected into the program, and interviews and all that. And of course, for those who have been offered a scholarship, you'll be bonded to the government, all right? Plus your undergrad and your master's. So the bonding will varies from 5 years to 7 years, depending on which system you go to, right? As far as the parallel program, of course, there is no specific requirement you only take 1 year after your basic degree. You can always sit for your part 1. And for those people who have the money, who have the time to study, the fastest you can get your MRCP is 5 months. Because there's so many centers now. Kan? Dato', there's so many centers now. UK, Hong Kong, Malaysia, Abu Dhabi, where India, Singapore. Okay? So if you are really, really bright and you have the money, okay, it only take about 14,000 to pass your MRCP. So the fastest so far we have is 5 months. But of course you don't have any experience. How are you going to hit the department if you don't have the experience? So we have certain criteria for you to become a doctor for those who want fast track. Okay, not so fast. You can pass the exam, but it's just a paper qualification. But you will not be registered as a specialist until you fulfill certain requirement. All right. So this is to show you our specialist program in the country. We have the local. It's divided into the clinical, right? Clinical. We have 20 programs for the clinical master's program, and the public health and the FMS. All right. For overseas, as I told you, the membership program, the MRCP, MRCP-CH, MRCOG, FRCS, and of course, this is on your own initiative, right? Be self-sponsored for the para program. You're not bonded. So this is one of the fast track and one of the most popular programs that most of our pediatrician and our internal medicine physician go through, right? Because you are not bonded. You have to spend your own money. And as far as public health is concerned, you can major in the specialty like epidemiology, family health, occupational health, and so forth, right? But we do send our doctors. As such, we encourage our doctors to undergo the specialist training within the country, which is our master's program. But for those disciplines which is not actually adequate in the country, like forensic, clinical oncologists, we do sponsor these people, doctors, for overseas training. But of course, for the FRCR oncology, you have to pass your part 1 first, okay, before we sponsor you, right? But of course, there are not many takers in FRCR. By experience, we sent a few doctors for FRCR, but they never come back. The latest we have now, this doctor never came back, already 12 years overseas. She or he has not come back until now, you know. So that's how it's a bit risky sending people for clinical oncology, but we need people to fill up our, you know, to provide service in our oncology department as well as in our IKN. And forensic, we do get people to send maybe about 1 or 2 per year. We do send people. And as far as the clinical governance is concerned, because we don't have enough slot masters in hospital administration, we do send our doctors for 18 months training in the South Bank, UK, in Australia, and also in Philippines. So far, we do sponsor our doctors for overseas training. But the rest of the clinical specialty, we do encourage all of you to join the local master's program. Okay. Okay, just to share with you the difference between the open and the closed system, all right? As the name suggests, open meaning that half of the training or full training is being done in our Ministry of Health hospital. Some of the discipline you have 1+3, 1 year in the Ministry of Health hospital, 3 years in the universities, or they have 2+2 or 4 years, like general surgery. All the 4 years is being done in our Ministry of Health hospital. All right, we have about 28 hospitals in the Ministry of Health which is accredited as a master's training center. Right, not all the 141 are accredited, but only 28 accredited for the master's training program. Right, and of course full time, all the 4 years is in the universities. Right, but of course the ratio between the closed and open is 40 to 60. 60% in the MOH hospital, and 40% for the closed system. All right, and as far as the bonding is concerned, for open system, you will not be getting your allowance or your scholarship, or you are given a paid leave. So your bonding is much less, about 5 years. But as compared to the closed system, you are given much more. Alright, you're given allowance, Sara Hidup and all that, so you're bonded for about 7 years, plus your undergrad bonding, for those people who have been sponsored by the government. So you have 10 years of undergrad plus, so until you retire, you're bonded to the government. Right? But for those people, but the good news is that for those who goes for the open system, right, your bonding will run consecutively during your training period as compared to those who take the closed system. Alright, as you join the closed system, your bonding stops there. Right, as compared to the open. Right, so there are disadvantages and advantages of the two systems. Okay, these are some of the specialty that we have. The one in red is actually working under the public health setup. So we have about 22 transfusion, where forensic, even though we do send people as a separate specialty, but in the country they are sharing the Department of Pathology in the beginning. The first year, the general pathology, they share the first year as a general pathologist, right? And from the second year onwards, they go geared towards the forensic medicine, right? But all these 22 programs are not found in all the universities, right? Like neurosurgery is only found in the USM, right? Neurosurgery transfusion is only found in USM. So you have to go to Kelantan, right? For those people who wants to sit in Klang Valley, so you cannot be a neurosurgeon, all right? Plastic surgery also is only offered by USM. Pediatric surgery only in UM, right? And of course, the rest are being offered in UKM, USM, and UM, right? Okay, just to share with you what are the recognized postgrad qualifications, right? That we have several, quite a number of postgraduate qualifications recognized by the government. So in general, all the local programs provided by our local universities are being recognized by the government, right? So they get sponsored by the JPA, from the JPA, right? So majority of the local programs, except for KPJ, I don't know whether you have heard. Is there anyone from KPJ here? So lately KPJ has also offered a master's program in ENT, and also several in ENT and medical. There are quite a number which are being offered by the KPG hospital, because I think throughout the country they've got around 80 over hospital with 100 over specialists. So they have already offered a few. Now the established one is masters in ENT KPJ, right? However, this master's program offered by KPJ is not recognized by the government. So if you want to join that program, it's at your own risk. You won't get your specialist allowance. You can go for the training. You can become a medical officer with interest in ENT, but you will not become a specialist in ENT, because as far as I know, NSR has not recognized. I don't think so. NSR has recognized Masters ENT from KPJ as yet. Maybe in future, I'm not sure, but at the moment it's not yet. So that is for the future. Our private hospital is also opening up to contribute in the specialist training by offering the master's program. But as I said, private hospital, they have their own private patients, so they might complain, getting managing by the so-called trainees, right? And also, I think they don't have enough supervision, maybe, because they are there, they start counting the money, whereas like Dato' Amar is very much committed to serve the rakyat, so he can come any time of the day, whereas those serving the private, alright, no money, I don't come. So how are you going to manage your patient as well as your trainee, alright? So anyway, maybe there's, in future we might do that. As far as the overseas is concerned, in general, those postgrad qualifications recognized so far from UK, USA, and Australia and New Zealand are recognized by the government. However, you have to show proof. Like in UK, for the medical discipline, you have to show proof you have CCST. You can undergo the training, but without the CCST, you are not deemed to be a specialist. We have a few who comes back from overseas, who call themselves a specialist, okay? But when we ask for CCST, they don't have that. So we will not appoint these people as a specialist. However, we can take you in as a medical officer. All right? And so please bear in mind for those people who are from overseas, coming back from overseas, right? We do want to help you, but if you do not show us the evidence, of course, we will not appoint you as a specialist. And same wise goes with those from US. If you are board certified, then only we will take you in as a specialist. However, you still have to undergo a certain period of probational period to be assessed, a minimum of 6 months before you are deemed to be a specialist. Okay? But in general, UK, US, and Australia. But of course, like those people who are already senior there, staying there for more than 10 to 20 years, they come back with FRCR and all that. We do not recognize. FRCR from 2000 onwards, we do not recognize any FRCS unless you have intercollegiate or CCST, right? But you all are very young, so maybe they changed after this. Royal College might change the new registration over there, so it goes with time. My time is over. Okay, all right, okay. Okay, parallel pathway, I already told you. With the limited numbers of slot in the master's program, right? So we do encourage our doctors to undergo the parallel pathways, but of course it's on your own initiative and your own funding, all right? But now we have already sent out the circulars to all the state departments that for those who pass their part 1, they have to register with us in the Medical Development Division, and we will make sure we post you to the right department, because just to share with you, there are some doctors who pass the MRCP and want to be gazetted as a specialist soon after. Well, sad to say that if you don't have the experience, for example, if you have taken MRCP, if you do not have 4 years of training in internal medicine, you will not be registered as a specialist in internal medicine, all right? So there's and then some of them, they like to stay in the clinic kesihatan because they want to sit for this paper. They don't want to be on call. They want to sit in anesthesia forever and ever. They want to sit in cardiology forever and ever, and then they sit for the MRCP. So mind you, we will not gazette you as a specialist if you do not have that experience. Okay, right. And also for those who have part 1, if they want to join the master's program, we will, the weightage is much more. And weightage for the masters is not only those with part 1, but for those who serve Sabah and Sarawak, we give priority. Those who go to Sabah, Sarawak, priority for master's program, all right? Okay, just to show you the number that comes out, is a very, I'm not sure you can see, but I just want to share with you the numbers that comes out from the master's program. Roughly is about 50% that comes out from the master's program. So if you see there in 2004, at that point in time, we only give about 450 scholarships, and those that come out, that really find the route to come up back to Ministry of Health, they're only about 200. Compared to now, we've got about 360, where the number of scholarships has been increased to 600. So all in all, we've got about 50% that comes out from the training program. But these include the numbers of the clinician only. On average, FMS, they produce about 12 FMS per year. It's quite a tough program, FMS. In fact, there was 1 year where they don't have any output at all. It's very difficult. I don't know why. Maybe something wrong with the curriculum, or I'm not sure why. Or they went in for a wrong reason. Public health, they train, the output is about 30 per year, right? But now public health is about 4 years training program, right? It's a 4 years. Unlike before, it's only 18 months, 1 year to 18 months, right? And this is just to show the status of our specialists in the MOH. You see here our subspecialty, about 800 over, roughly about I think 20%. Which I'm not going to say anything from that Omar. I don't know whether with the increase in number of sub, our generalists is dwindling in the numbers, because so many want to fast track and become sub, and suddenly they go out after the sub. Alright, so you see here, we as of December 2013, we've got about 3,008. But as it stands right now, currently we have add on the June the November 2013 master's output. So currently we've got about 4,000 in the Ministry of Health, 4,000 clinicians, excluding the FMS and public health. So, but we need I think about 15,000 specialists for the country in 2015. So we got a long way to go. That's why we need more doctors now, in order for you all to be specialists and not just MOT. MOT is what? MO2, senior specialist, alright? Alright, okay. Just a little bit, I touch on Gazettement as a specialist. So who is actually a specialist? A doctor who have a recognized postgraduate qualification and has been certified to be capable of functioning as a specialist independently. Alright, we have at the moment a clinical specialist who have already undergone 3 years of probational period and cannot be gazetted. So now this person has to think several times whether he or she wants to continue as a medical officer, because he's deemed to be not safe, right? So we do have few people, but not many, very few. You can count those that we have not gazetted, even though you have the paper qualification, right? And in the Ministry of Health, all right, only for those people who serve the ministry, we gazette you as a specialist and eligible for the specialist allowance. All right, they're quite a number. It's quite a lot of money, specialist allowance. I think that Amar will be getting about 4,000 specialist allowance. He's not sure, he's so rich, he cannot be bothered with the specialist allowance. So the specialist allowance go based on your grades, okay? As low down as 1,200, it goes up to about 3,008. So that Amar will be getting about 4,000 specialist allowance, which he doesn't need. And all in all, I think he's getting about 30,000. Not sure. So he got a lot of money because he's already an A, right? So to be an A, 30,000. But if you compare with those in the private, they're getting 110,000, 100,000 a month. So 30,000 is nothing for Dato' Omar, because you can get to do the locum now. Alright, but for those people who are cardiologists, anesthesia, they easily get about 100,000 a month. So think where you want to go. We cannot compare. I mean, we cannot give more than that in the Ministry of Health. Alright, only if you have the capacity, you are committed like Dato' Amar. He stay put until I think Dato' Omar is committed. He's staying until retiring, right? Pasti I kena. But for the private sector, okay, so those who are gazetted by the ministry, your name will be in the Warta Kerajaan, But for those who do not be gazetted in ministry, their name will not be found there. Only special for those who serve Ministry of Health. You be gazetted, you get the allowance, but of course it's not much as compared to the private, but your name will be in that Siri Warta Kerajaan. And those who want to be in the private, of course you have to go through the NSR first. Okay, NSR have their own criteria, similar to MOH criteria, but they are additional, right? So it's not automatic that if you are gazetted by the Ministry of Health, that you should automatically be in the NSR. You have to apply. Okay, so it's not automatic. More so if your qualification is not a recognized qualification. Like we do have people who we take as a contract officer, whom their qualification is not recognized. But we do take foreigners to serve our hospital in Sabah, Sarawak. So we do recognize them, but once they go out, NSR has to take care of them. So there are some who we do gazette them in the ministry, but they do not fulfill the NSR requirements, so they cannot be, they cannot practice as a specialist out there, alright? So you're still not safe, you do not have a recognized qualification, postgrad qualification, alright? So under the Medical Act 1971 amended 2012, section 14A, no person whose name has not been listed into the specialist register shall practice as a specialist in that specialty. But for those who are working in the government, big Ministry of Health is the biggest insurance company, so you're actually covered if you work in the Ministry of Health. But of course, this act has not been formalized yet or gazetted yet. But we do encourage our specialists to register with the National Special Register, especially for those who want to go out to the private. So you are deemed a specialist in the ministry, but not for the country in the NSR. I got 10 minutes left. Okay, this is to show you the variation of probational period. For those who pass the masters, they only have to undergo a minimum of 6 months. Same goes with those with membership, but for membership there's a special allowance. You have to add on another 1 year training. So that's why I mentioned to you, even though you have the paper qualification, you can only be gazetted or undergo the probational period if you have 4 years training in whatever discipline, the related discipline, right? Okay, just to touch a bit on sub, which I think you have a long way to go. But just to tell you, we have at the moment 15 specialty with more about 100 established programs under subspecialty, which is actually offered big train in our MOH hospital. Alright, so it's a 3 to 4 years training, where the 2 years is being done in the country, and 1 year we encourage our specialists to go for overseas. And at the moment, the subspecialty will be bonded as well, because we offer them the scholarship. Unlike before, 2 years ago, people who comes in and people who goes out and then they resign. We don't get anything. We just train them and nothing gain. So that's why in 2011 the government had decided to offer scholarship for those people who wants to join the subspecialty program. And you'll be bonded depending on whether you go overseas or not. Right? If you do all the 3 years in the country, you're only bonded about 4 years. But for those people who go for 1 year overseas, right, 2 plus 1, you'll be bonded another 2 years, so 6 years, right? So this is, you just take note, you got a long way to go. You have to pass your MBBS first, right? Don't dream. You can start dreaming anyway, alright? Okay, so we also have specialists who wants to go for a short training. They don't want to have long bonding and all that, but they are only called area of interest. That means they will not be gazetted as a subspecialist. Right? So you go for shorter training, like 6 to 12 months, and we do give scholarship for overseas training. And for these people, they'll be bonded only for 3 years. All right, this short training. But majority of training is about 3 years. All right. All right. I think now we are going towards the shorter area of interest, because as I'm aware, as all of you are aware, this NSR has listed quite a number of specialty and subspecialty in the NSR, and compared to the world, Malaysia is second to US with the most number of specialty and subspecialty. I think in US there are about 200 over different specialty, and some in Malaysia we have about 100 over 170, second to America. So now I think our DG has asked the NSR to relook at all the specialty, and we are able to, in fact, add on more subspecialty. So that's why now we're going towards the area of interest. So as an area of interest, you don't need 3 years training, right? So the entry requirement is actually 1 year after gazettement into this program, all right? But we have a fast track, especially for those areas like geriatric, but it's not really popular. Because everybody wants to be youngster, they don't want to be a geriatrician. So even though we open up, requirement for the geriatrics, but no takers so far, right? Okay, just to share with you, the maximum number of subspecialty is under pediatric. You can ask Dato' Omar why. Because there's pediatric people, so many left hand, right hand, left eye, right eye. Joke aside, okay. So these are some of the area of interest that we have so far recognized. Okay, under the pathology, they have virology, they have transfusion, they have, I don't know, so many of them. And under rehab, cardiac rehab, stroke rehab, neuro rehab, PITS rehab. But the PITS rehab, I heard the pediatrician and the rehab are quarreling which door should they go in, which door should they come out, and it's not yet settled, not yet settled. So by the time you come out, I think it will be established lah, don't worry. Alright. And emergency, they have a few also, disaster, emergency, clinical toxicology. Right? Okay. Okay, something about recruitment, I don't know whether it's too early to tell you, but for those people who comes back from overseas, they really want to know what is the stand right now. I think Talent Corp, who's proudly sponsored this program today, they're also looking at this, calling all of you back to Malaysia to serve in the country. But sadly to say, those who comes from the Talent Corp, they prefer to be in the private sector. But being Malaysian, you have to undergo your compulsory service of 2 years. Right? Previously it was 3 years, but currently now it has been reduced to 2 years compulsory service as Malaysian. Before you can practice in the private, you have to undergo that. Alright? So if you come in as a medical graduate, it's better if you apply to MMC first for registration, and concurrent you can send to SPA, alright, to be appointed as a civil servant, and of course you also have to apply to MOH to be appointed to undergo your housemanship training. For those people who are fresh from the oven, you have to come and do your housemanship training, which is actually in the public hospital, 39 hospital plus 3 university hospital, right? So you'll be appointed either as a contract or as a permanent, and your grade will be UD 41, alright? But if you come back as a medical officer, okay, as a medical officer, as such, our current policy is to take medical officer from overseas as a contract officer and give you a chance to go to undergo your compulsory service of 2 years. Then you can find your work either in universities or in the private sector. Right? Because at this point in time, we don't have enough posts for medical officer, but maybe in a few years' time, we'll get more from GPE. But at this point in time, we are only taking medical officers as a contract, 2 years contract. So giving you a chance to do your compulsory service, and then out you go. Alright? And if you come back as a specialist, it's much better. We will offer you lateral entry. Lateral entry is actually a permanent post in the Ministry of Health or in the universities. Okay? But a lot of those who comes back through Talent Corp, they want to be in the private. And if you are a specialist, you have to apply to NSR first. Right? But for those who comes with an unquestionable qualification, then it's a bit difficult, you know, because you have to be you have to undergo certain probational period in the Ministry of Health hospital before you can be registered. That is the new criteria in the NSR. For those people who has never worked in the government, you have to be exposed to the healthcare system. So that's why certain discipline has put a criteria. You have to be attached for about 6 months to about 2 years, depending on the specialty that you are applying for. So you might as well, if you have a postgrad qualification, apply directly to join the ministry, go for 2 years, you get gazetted, and then out you go. Right? But a lot of people want to come back and go right to the private because they want to earn a lot. Right? Okay, yeah, I just told you already all that. Alright. Okay, for those people with who are already a specialist for a number of years, who are quite senior in overseas, they can be exempted for compulsory service if you are aged more than 45 years with an established critical specialty. You all have not fulfilled yet, I'm just telling you, okay? So you have an option. If you don't want to do your compulsory service in the Ministry of Health Hospital, you can apply to the MMC to do in the universities, right? But for exemption, there are criteria for exemption, right? But not for medical officer, alright? Only for specialists, you are exempted. Okay, so these are the options for compulsory service. Alright. This one, as it stands, is still valid. Time-based promotion is still valid in the Ministry of Health. So 2 years as a houseman, you are on UD 41. And after successfully completion of the 2 years training, you are being promoted to UD 44, right? And halfway through your masters, if you join the masters, you will be promoted to UD 48 and so forth. And unlike before, if you have a specialist qualification, after 9 years of service, I think, you are promoted to 54. During my time, I was promoted to UD 48 when I was 48 years old. And I was promoted to 52 when I was 52 years old. So now no more for me. But you all are very lucky groups. The promotion is much earlier, but by the time you come in, I think maybe there will be additional UD 54A, UD 54B, before you get to go for JUSASI, because now everybody wants to be a JUSASI, you know, but it takes some time to be a JUSASI, alright? But as far as we're concerned, JUSASI, there are about 800 over in the Ministry of Health compared to other ministry. We are the lucky ministry actually. Alright, so I think that's about all. Thank you so much. And if there's any question, Dr. Amar can answer you. Thank you.
Thank you, Dr. Sabariah, for your speech. I believe that it was a very informative and very interesting speech. There is a lot of things that we have to take home and mull over. So I hope that you guys appreciate her and her presence over here. My comrade over here has been liaising with her over the past few weeks, and she's just the most humble person, and she's so fluent in what she was saying today. Obviously, she knows what she was talking about, so we're really, really grateful to have her spend a Saturday morning with us, telling us all these vital information. Right, guys? Alright, so without further ado, I would like to invite John, who is also the co-chairperson of our MMI Association, to present 2 tokens of appreciation to her. The first one from us, MMI. As well as one from Talent Corp as well. Thank you, Dr. Sabariah.